Good morning, everyone, and thank you for coming today. And I will now turn the podium over to Minister LaGrange.
Eight times more children were hospitalized for anxiety disorders than for COVID during these past 18 months. Was this as a result of the lockdowns or health measures? And how does this differ from previous pre-COVID years? Do you have any hard numbers on that?
Thank you for the question. The data, to be clear...
Mr. LaGrange, but as I kind of hinted at earlier, a lot of the lower vaccination rates around the province are certainly in different rural areas. When it comes to sort of helping schools in rural areas, what kind of, well, these some of the measures that are announced today, how will they sort of help those rural schools in the province?
Anymore for close contacts of declared cases, but you mentioned that cohorting, masking, and social distancing could be required in certain scenarios if there's an outbreak. Can you give more specifics as to what those scenarios would be and under which circumstances an outbreak could be declared in schools, obviously?
Sure, and I'll leave the rest to Minister LaGrange.
So I'm wondering, is that a hard date, or is there a possibility that we're back here, the Friday before that, hearing the same thing? If the case numbers get worse, if hospitalizations get worse, if hopefully it doesn't happen, but if deaths get worse, could, the mandatory isolation and the symptomatic testing extend beyond September 27th?
The purpose of monitoring is to be able to assess exactly that. One of the key pieces of the plan forward is that we really have to stop treating COVID like it is the only and most significant risk for our children.
Okay, thank you everyone. That's all we have time for. If you have any follow-ups, please reach out to myself or Dr. Hinshaw's team.